Keeping you health aware as American Heart Month draws to a close, an Arclatech surgeon wants to shine a spotlight on a group of unsung heroes. They're the members of the Heart Team, the medical professionals who work tirelessly to save heart patients every day. So joining us now is Dr. Timothy Danish, a cardiothoracic surgeon at Christus Health. So doctor, thank you so much for joining us today.
Absolutely. Thank you for having me.
Let's talk a little bit about the Heart Team, who's on it and what their primary role is.
So the Heart Team is a relatively modern concept in cardiovascular medicine. Think of it as a collaboration between different specialists, surgeons, cardiologists, interventional cardiologists, and other supporting members of the team like echo technicians, nurse practitioners, and so forth. And what we do is we meet about once a week and we discuss cases or patient referrals together to try to come up with a plan for patients that are particularly complex.
So this is really bringing everybody in that has a certain special area of expertise and letting them look at the problem and your problem solving together.
That's exactly right. That collaboration ideally brings the collective knowledge of everyone in the group to come up with the best plan for complicated patients.
So you said that you meet once a week. You're focusing on specific patients, but when does the team really spring into action?
You know, that might be if there's a patient referred to us by a primary care doctor or perhaps an outside cardiologist and they get referred to our team. They might have any number of conditions like heart blockages, coronary artery disease, or valvular heart disease. The patients would get referred to our team and then we kind of discuss them as a group and come up with a plan.
So how frequently are you seeing these complicated cases that are coming in that require the entirety of the team?
It's getting more frequent. Patients are living longer, patients have more medical problems to deal with, and so when we set out to do what we think of as a routine surgery, like a bypass surgery, it might be more complicated than usual and require input from all of our team members.
You were telling me, you know, each surgery may start out the same with the same goal and the same outcome, but each patient is different, so you're having to pivot constantly.
Absolutely. That's especially in cardiovascular medicine, it can be particularly technical focused and require lots of knowledge and lots of technical skill and experience to get the patient through it.
I'm sure it has to be very reassuring for the patients, though, to know that they've got such a good team that it's working together for them.
I hope so. That's our goal, and I feel strongly that this offers the patients the best options, getting that team opinion together.
I know you mentioned the referrals that are coming to you. How often are you seeing referrals just from within our area and even, you know, the occasional referral out of our state?
Both happen. It's very common for patients in this region in Shreveport-Bossier to be referred. That's the most common. We do occasionally get referrals from outside the area too, up maybe 100 miles or so.
Okay, gotcha. So managing the input of so many professionals all in one spot is probably a huge logistical challenge because your schedules, I imagine, are very, very hectic. So how has technology really helped and assisted in this?
Technology has kicked in. You know, we have things like Zoom and team meetings that we can all collaborate. Even if a doctor is in office hours, say for example, and they can't make it to the meeting, they just join us on a Zoom and we can all look at the images on a display together, heart cath images, echo images, and we all collaborate in that way.
Well, while we have you here, you know, we've done a lot of education for American Heart Health throughout the week. Can you give us some tips that we should keep in mind for good heart health?
If you have risk factors for heart disease, such as history of diabetes, high blood pressure, smoking, or especially a family history of heart disease, particularly at young age, please get referred to a cardiologist to get checked out.
Okay, so is it ever too early to start getting checked out?
Oh, maybe once you reach, it depends on each individual family, depending on the age that the onset of heart disease came, but it could be as young as the 30s or 40s, so maybe not.
Okay, so it's really good to go ahead and start, you know, making the list of factors that could affect you and looking at how you can maybe incorporate some lifestyle changes, maybe get a little more active, maybe cut back on some of the bad habits that you may have picked up over the years to make sure that you're as heart healthy as can be.
That's exactly right.
Well, doctor, thank you so much for joining us today, and thank you for sharing your expertise and your incredible team. Thank you.
My pleasure, my honor. Thank you.